which of the following is a potential complication associated with her condition? 30-year-old woman at 12 weeks gestation presents to clinic with severe nausea and vomiting past 3 weeks. Reports losing 5% of her pre-pregnancy weight due to her inability to keep down food and fluids. Lab tests reveal hypokalemia and ketonuria. Which of the following is a potential complication associated with her condition? Okay, so she is I guess 30 is 30 middle age. Dang, we're old. 30 is middle age. So she's I mean she's like prime childbearing years. 12 weeks pregnant. Um Nauseous and vomiting for past 3 weeks. Lost a lot of weight, 5% of it, and because she can't eat and can't drink. Okay. Um Hypokalemia. So she's losing the vomiting, she's losing a lot of electrolytes,
Okay.
ketonuria, and she's not so ketonuria. So I guess she's relying um on what's it called? Like on fats to kind of keep her going for energy source. She's not able to keep down her food.
Okay.
Um,
Good.
so enough nutrients for her and the baby, which is the following is complication. Um, if she's not getting enough food, can't keep it. I'm not sure where to go there. I don't.
So this question is all about risk factors, right?
Yeah.
So for instance, right, I think you worked through it beautifully in saying like, you know, she's in her first almost second trimester, right? Severe nausea, vomiting for the past 3 weeks. So you know that she's not keeping fluids down. She's lost 5% of pre-pregnancy weight, which is never good, right? So she's not gaining weight. She needs to be gaining weight for the kid, right? Because she's eating for two, not just for one. And then, like you said, you work through the hypokalemia, and then the ketonuria is because she's not eating enough. So her body is using fat as energy instead of her regular diet. So now you have to ask yourself, okay, so she's losing weight, she's not keeping down fluids. How is that going to affect the baby and her, right?
Mhm.
So when you look through these, you should be thinking polyhydramnios, meaning a lot of amniotic fluid.
Yeah.
Gestational hypertension, meaning that she gets high blood pressure. Wernicke's encephalopathy, right? Meaning that mostly that's with alcoholism. She can get confused confabulations, right? Oligohydramnios, meaning low amniotic fluid. And then gestational diabetes, meaning she has a lot of glucose during her pregnancy. So which one of those fits with kind of, what you know generally about this patient?
Um, so she does not have a lot of glucose because she's going through ketonuria. So it wouldn't be gestational diabetes, right? I'm leaning more towards oligohydramnios.
Okay, final
Because
answer.
yeah, let's go with that.
Yeah, I would have picked that. Hold on. That's what I would have picked. I'm not sure why they picked Warnicki's, to be honest. Let's kind of see. I might throw this question out because it's not directly to hemorrhage. It's real rupture, membranes, placental,
Hmm.
patients, nausea, weight loss, hypo is consistent with hyperemesis gravidarum, which is the diagnosis. Just means that she throws up a lot during pregnancy. A potential combination of this is Wernicke's encephalopathy, which is thiamine B1 deficiency due to. Oh, okay. So that's something that
I
I
guess that
I
makes
learned.
sense.
Okay, I
Yeah.
was actually in my mindset when I read this was I was also thinking oligo because the way I want you to think is I want you to think as direct as possible if you don't know like exactly. You know what I'm trying to say? So
Yeah.
in my logic, if you're throwing up, not having enough fluids, not having nutrition, then I would think that your body's not creating enough amniotic fluid. Is that true or not? I'm not 100% sure, but through logic, it makes sense to me. You know what I mean?
Yeah.
So, in this, when you read the explanation, this actually makes sense because obviously, if you're not eating enough and you're throwing up, then you're not going to get enough B1. If you're not going to get enough B1, then of course you're going to have Wernicke's, like just like an alcohol, right? Or an alcoholic, right? Where they drink so much where they don't have nutrition, then of course they're going to get Wernicke's. So, when they look at this, it says like, polyhydramnios and oligohydramnios, it's not really risk factors for hyperemesis gravidarum. So that's something that even me personally, I learned from this, right? But now, does it make sense? Kind of now, you're like, okay, so if you throw up, then you don't get nutrition. If you don't get nutrition, then obviously you're not going to get B1.
Yeah.
So you make that direct connection. But yeah, I would say that if I, when I was doing this question, I was leaning towards D for sure. So, all right.